We are live. We are live. I'm Dr. Frita. Welcome to Medical Monday, where we talk celebrity health and all of the hot health topics in the headlines. As usual, we have a jam-packed show for you today, and I'll be giving you evidence-based medicine on all the various issues, from celebrities to what's going on in politics that's affecting your health. We'll open up talking about some news that's a bit breaking because we have had a measles case right here in Atlanta, in Fulton County. A resident has the measles. Now, one thing to know about the measles is that it's highly, highly contagious. And so if you have been exposed, you need to know, especially if you're unvaccinated or if you've never had the measles. Also, there's been some more talk. I was on News Nation just this morning talking about some updates on RFK Jr., chronic illnesses, and on how a Republican lawmaker is urging RFK Jr. to encourage people to get the pertussis vaccine, because whooping cough is now on the rise in Louisiana. So we'll talk about that. Then we'll play my favorite game, Myth versus Fact. And this one will be around colon cancer, colorectal cancer. It's been 5 years since we lost our beloved Chadwick Boseman, you know, the Black Panther and the phenomenal actor. And so we'll talk about colorectal cancer, specifically how it's affecting young people. It's on the rise in young people. So we'll talk about signs and symptoms. And very importantly, we'll talk about prevention. And then we'll move on to our weekly dose, where I give you a fresh take on all of the hot health topics that you simply can't get anywhere else. We'll start off talking about Bruce Willis of Die Hard, The Sixth Sense, of Moonlighting, for those of you who can take it on back. Well, we know that he has a diagnosis of frontotemporal dementia, but we'll break it down a bit. We'll talk about dementia versus Alzheimer's versus frontotemporal dementia. What is the difference? What do you need to know? And then we will talk about Billy Porter, the phenomenal Billy Porter, who has had to stop a Broadway appearance a bit early, or a cabaret show a bit early, because he has sepsis. Sepsis. What is sepsis? Well, just keep watching because you'll find out. We'll break it down and we'll talk about signs and symptoms, causes, how to prevent it, how to recognize it. And then we'll talk about Selena Gomez, the singer, the actor, who's been very open about her various health journeys, including living with lupus. And so we'll take it to a larger conversation on invisible diseases, how to cope with invisible diseases such as lupus. And I want you to be thinking, what are some other diseases that aren't obvious, but that can cause you to have some impairments? And then we'll talk about how Selena Gomez has taken her illness and really used it to promote good in one of her latest business ventures. Next, we will talk about Chagas disease. Chaga. What is that? Oh, you'll know, because there is something called the kissing bug. And that might sound cute, but it's not. The kissing bug can cause you to have a parasite that can be life-threatening. And guess what? It's here. It's in the United States, especially in Texas. So we'll talk about that. And of course, we are live. I'm Dr. Frita. You can ask me questions, but guess what? I'm asking you questions too, because this is interactive. It's Medical Monday. Let's get started. Go ahead and give us a like as we move into this evidence-based information excitement. Hey, we're live. I'm Dr. Frita, and we're getting started with our Medical Monday, where I give you celebrity health and all of the hot health topics in the headlines. I'm not doing this thing alone, and y'all already know that. Please come to the front of the stage. Office manager, Ms. Shador, and my co-host, of course. How are you doing, Shador?
Hey, doing pretty good. How are you?
Doing really well. Kind of running on fumes a bit, been all over the place, but doing well. But I'm going to tell you, Shador, some of the people who are in our headlines today for our hot health topics aren't doing so well. And so we'll talk about what's going on with them. And as always, we'll take their stories. I'll give you the evidence-based medicine behind it so that we can live our healthiest, happiest lives. And so, again, I ask you to give us a like as you join us, because we will be giving you evidence-based medicine. And go ahead and give us a share, okay? Go to your group me, go to your WhatsApp, go to your group chat, call your mama, and let them know we are here and we're giving you really good information. I am Dr. Frita. For those of you who are new to our channel, I am a board certified physician. I'm an MD. I'm a board certified nephrologist, meaning I'm a board certified kidney doctor and high blood pressure doctor. I have also been board certified in internal medicine, pediatrics, and obesity medicine. And so I like to talk about a lot. And more importantly, I love to share my information with you, which is what we're doing right here live. Shador, who was the first person in the chat today?
First in the chat today is Purple Onion.
Hey, Purple Onion, how are you doing?
Purple
I
Onion
love
running
that
3
name.
weeks
And I
strong
love
being first.
what happened.
Purple Onion running 3 weeks strong being first in the chat.
You know what? It's like a marathon, but you need to come onto the front of the class, Purple Onion, and go ahead and get your fingers ready because I need your reactions, interactions, and your answers as always. All right. So I had an exciting morning this morning, Shador. I was on News Nation, that national news channel. They have Chris Cuomo there, Dan Abrams there. And, you get some good evidence-based information there. And they keep it pretty fact-based. Well, they asked me this morning to do a medical expert segment on some of the things going on with politics as they relate to health. And so, that the head of the Department of Health and Human Services, RFK Jr., has released new information on chronic illnesses, on childhood diseases. And so I talked about that today. And I talked more about his Make America Healthy agenda. And very specifically, I was open and truthful about some of the shortcomings in it, including not necessarily, securing food securities, not necessarily making these healthy foods affordable for people with low income. And so we talked about some of the pros, some of the cons. I always like to tussle with RFK Jr., but hopefully the lawmakers will pay attention to the science and the evidence. And there's actually a good sign, Shador, because one Republican lawmaker, Senator Cassidy, Republican, okay, and he's in Louisiana, but he has noted, as has been noted by all of the data, that there's been an increase in whooping cough, okay, caused by pertussis. Now, pertussis is something that is very preventable, okay? We have vaccines that prevent it, but for babies who get it, it can be life-threatening. It causes them to cough and turn blue and not be able to breathe. And then they have this classic deep inhalation where they try to catch their breath and it has like a high-pitched whooping sound like, whoop. That was, okay. So dang, that was pretty good. Y'all need to make that a sound bite. But it's actually, quite serious because it's life-threatening. And so what Senator Cassidy is doing is he's really asking and even pleading with RFK Jr. to publicly endorse people getting the pertussis vaccine because, again, we're starting to get lower uptake of vaccines. And when that happens, we lose our herd immunity, as we've discussed, and we're getting increasing cases of whooping cough or pertussis in Louisiana. And as you know, diseases do not respect borders. And so what's happening in one state can happen to other states, which takes us to something else, measles. We know we've had the most cases of measles, more cases than we've had in 30 years. And that was largely in West Texas. Well, guess what, Shador? We have a measles case right here in Atlanta. In Fulton County, a resident has measles. It's been confirmed by the Georgia Department of Public Health. And this person with measles has not been locked up in the room sleep. This person has been to Georgia State University, the Sweet Green Restaurant on North Avenue in Atlanta, the Inter-Atlanta FC soccer games and soccer practices. And so if you've been to any of those places between September 2nd and September 11th in the Atlanta area, then pay attention for symptoms of the measles. I give you more information if you check out, just follow me, please, on all social media platforms. So on Instagram, TikTok, on LinkedIn as well, on Facebook, I went and did breaking news on the day that the information was released. And I give you details on symptoms of measles, what to look out for, what to do if you have symptoms. But here's what's really important. If you have been vaccinated against measles with the MMR vaccine, just one shot gives you 95% protection against getting the measles. And if you've gotten both recommended doses of MMR, you have a 98% chance of not getting the measles. The problem comes, Shador, with young kids who are less than 1, because we don't even offer the MMR to our children until they're 12 months of age. And so if you have young babies, please be extra careful because measles is highly contagious. If you're exposed to measles and you are not vaccinated, and if you have not had measles, you have a 9 out of 10 chance of getting the measles. So all of this is related to vaccines. If the vaccines are decreased, then we will get more preventable diseases and our kids will get sick, people will lose lives. This is a fact. History shows us this. So that's what I was on the news talking about. So now, Shador, let's talk about what we're going to talk about today in celebrity health and some news here. Chadwick Boseman. Okay, I know if y'all are like me, y'all love y'all some Black Panther and some Chadwick Boseman. And we know that we lost him at the age of 43. He was actually diagnosed with colon cancer at the age of 39. And that's really significant because since the mid 1980s, the amount of people diagnosed with colon cancer between ages 20 to 39 has skyrocketed. That's the highest demographic with the greatest increase in colon cancer. So let's talk about colon cancer through myth versus fact. But Shador, let's first play this clip of someone talking about who worked with Chadwick Boseman, talking about him and how great he really, really was.
One second.
What was it like working with Chadwick Boseman? Because your screen test is online.
Yeah.
Is that weird?
Yeah. Yeah, guys. I get it, but dang, I was so young. Oh man, it was insane. Very humbling too, in the moment. I just remember thinking, wow, it's a literal king. That's crazy, genuinely, like he has that presence. So yeah, definitely, another battery in the back to make sure, and also just a reminder, another like wake up call on like your presence, because man, what a presence, And that was very, very, very inspiring, I think, to have experienced at that point in my journey.
How about somebody like Ryan Coogler? What have you learned from working around him?
To lock in, lock in and lean into the craft, do what you know, and trust that you know it. He was super encouraging, especially as a director. Like you were here for a reason, like you were casted for a reason. And even if he doesn't directly say that, I think the choices that he allows you to make and the things he allows you to figure out,
Proves it.
Yeah, it really does prove it. It empowers you in that way.
All right. So let's go ahead and do this myth versus fact segment. For those of you who are new to us, this is where it's interactive. Yes, everybody on IG, Facebook, to my replay crew, and of course right here on YouTube, where we have over 897,000 subscribers. Thank you. And if you haven't subscribed, please do, because we give you evidence-based information. But now it's time for y'all to go to work. Okay, class has started. So I'm going to present some myth versus fact statements and ask you what you think, and then we'll talk about it and we'll learn this thing together. Shador, what's our first myth versus fact statement as it pertains to colorectal cancer?
Yes, ma'am. Give me 1 second here. It's coming up. All right. Our first statement today. The official recommendation for Black Americans to begin colon cancer screening earlier than other demographic groups was created as a direct result of Chadwick Boseman's death.
Put an M1 if that's a myth, put an F1 if that's a fact. So we now know that for African Americans, we as a demographic are considered to be at higher risk. So are these new recommendations directly caused by the death of Chadwick Boseman? M1 if that's a myth, if they weren't caused just because of him, or F1 if that's a fact, if it is because of him that the recommendations changed. All right, myth versus fact statement number 2.
Eating a high fiber diet can lower your risk of developing colon cancer.
Put an M2 if that's a myth, and F2 if that's a fact. Does eating a high fiber diet full of fruits and vegetables, can that actually decrease your risk for colon cancer? M2 if that's a myth, F2 if yeah, that's a fact. And Purple Onion, where are you? I know you're in here answering. All right, let's do one more and let's get these answers flowing. Statement 3, please.
Since the 1990s, the rate of colon cancer in adults over 65 has actually decreased, while the rate for adults under 50 has more than doubled.
Put an M3 if that's a myth, and F3 if that's a fact. All right, pencils down, pencils down. And as we go, we're going to go over these answers. And I also want you to put a CC for colon cancer and answer this question. What are some warning signs of colon cancer? What are some signs and symptoms of colon cancer? Put a CC in your answer. All right, Shador, statement number 1. What do we have?
All right. The official recommendation for Black Americans to begin colon cancer screening earlier than other demographic groups was created as a direct result of Chadwick Boseman's death. So,
all right. Any takers? Any takers?
Yes, ma'am. Our newest member, Marina.
Thank you for being a member, Marina. Welcome, welcome. Marina, I did drop a members only video for you guys this weekend. I also dropped one on September 11th. So check that out. Y'all know y'all get some behind the scenes on what's going on, a little extra medical information, plus just kind of what's going on in the background of the show here. Okay, what did Marina say?
Marina says fact.
It's a fact that it's because of Chadwick Boseman. He is the cause of the change of recommendations. Okay.
I can see clearly says a myth.
I can see clearly. Welcome back. Okay, you say it's a myth. So even though he did get, cancer at a young age, you don't think that he's the cause of it. Perhaps it was already going on, that there were recommendations for Black people to get earlier screening. All right, I can see clearly now. We'll see.
Anton says fact.
Hi, welcome back, Anton. You think it's a fact. It's because of him and all of his influence that we then changed the recommendations. Okay.
Aileen says a fact.
Hi, Aileen. Welcome, welcome. All right.
Londa says it's a fact.
All right. Because of Chadwick Boseman. Okay.
Jetty, hello, says myth.
Ooh, it's Jetty. Miss Jackson, if you're nasty. All right. Jetty says the myth.
And Miss Wansley says it is a myth.
A myth. So we got a mixed bag, Shador.
Mm-hmm.
I love a mixed bag because you know what that means? We've got some learning points. Okay. So the statement is that it's because of Chadwick Boseman that the recommendations for Black Americans to be tested earlier, that he is the reason that these recommendations changed. And this is actually a myth. It's a myth. But you know what that tells me? So many people overwhelmingly said fact. That means that Chadwick Boseman he actually played a really critical role in highlighting the fact that was already there. We already knew well before Chadwick Boseman's death that the rates of colon cancer in young people was increasing. And I shared with you that since the mid-1980s, ages 20 to 39, that demographic has had the greatest increase in colon cancer diagnoses. And Black people, hello, Black people, we have the highest rates of colon cancer out of all other ethnic groups. It affects us disproportionately, and Black men even more so. And so it's been an issue, and we've known that we get diagnosed early. We tend to get aggressive diagnoses. We have a significantly greater mortality, Black people, from colon cancer when compared to other ethnic groups. We already knew that before Chadwick Boseman had his diagnosis at age 39 and before he passed away 5 years ago. But thankfully, with all of his fame, his notoriety, his just being so beloved, that once he got the diagnosis and once we found out that he passed away with colon cancer, that made people aware. And now I'm learning, and you just reinforced it in the way that y'all mostly answered that question, that many of you did not know how serious it was for Black people to be screened earlier until Chadwick Boseman. So while his fame put a highlight on the recommendation for Black people to be screened earlier and perhaps more aggressively already existed. We already knew before Chadwick Boseman. And so this makes me even more thankful that even, in his death, we've been able to benefit as a whole, as far as people being more aware. So let's talk a little bit more about colon cancer. So yes, it's actually the second leading cause of cancer death, and it's the third most common cause of cancer. Males get it more frequently than women, a little more frequently than women, but Everybody can get it. Women certainly can get it as well. And we now even have more aggressive recommendations for just kind of everyone. People of average risk. It's recommended that you start your colon cancer screening at the age of 45. And you can have that discussion with your doctor to have a colonoscopy, which is considered the gold standard. But we also have improving DNA tests where you literally can put a stool sample on a card and they can test to see if you have the DNA of colon cancer for certain people. And yes, I know of patients like this and friends who just really, 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 really don't want colonoscopies. There are options. Now, are they exactly equally as effective? No, the colonoscopy as of now is still the gold standard, but these other tests like Cologuard are getting better and better. There's a sigmoidoscopy that only looks at the sigmoid, which is just really a portion of the colon. Now, I'll tell you right now, if I'm looking for colon cancer, I want something to look at my entire colon, not just a portion. Consult with your doctor, but the sigmoidoscopy is not the gold standard. And I wouldn't just look at a part of a colon if I wanted the whole thing. So colonoscopy, gold standard, but consult with your doctor. So there are different things that can put you at risk. And again, if I want you to tell me some signs and symptoms of colon cancer, put that C in the chat and give me what you think some signs and symptoms of colon cancer might be. But I will tell you some risk factors. Certainly, if you have a family history of colon cancer, especially in a first degree relative, like a mother, father, brother, sister, that increases your risk. If you are a Black person, we already talked about that, then you are more likely to get colon cancer than any other ethnic group in the United States and more likely to die from colon cancer. That's just the blunt truth. That's what we talk about here. We give you the truth. And other risk factors, if you have a family history of polyps. So polyps or even precancerous growths in the colon cancer, if you yourself have polyps or if a family member, okay, especially a first degree family member, listen, that's what we need to talk to each other about things. Our secrets make us sick. Ask your mama, ask your daddy, ask your brother, your sister, and your auntie, hey, have you had a colonoscopy? You know, talk about it at Thanksgiving dinner, talk about it on the weekend and say, okay, did you have any polyps? Yeah, because if they had polyps, that could increase your risk of having colon cancer. And then there's certain hereditary syndromes like Lynch syndrome, like also familial adenomatous polyposis, hereditary non-polyposis colorectal cancer syndrome. There's different genetic syndromes that can predispose you. Oh, and if you have inflammatory bowel disease, like Crohn's disease, ulcerative disease for sure, ulcerative colitis, very highly increases your risk for colon cancer. Okay. So those are some of the risk factors. And again, if you're a Black person, you are more likely to get colon cancer than any other ethnic group. All right, Shador, did anyone put in the chat what some signs and symptoms might be of colon cancer?
Absolutely.
All right.
So we have, I can see clearly.
What do you see clearly? What do you say?
Change in bowel movement.
Very good. So you can have diarrhea, you can have constipation. And do you know what else I can see clearly? You can have a change in the caliber of your stool. Instead of your stool being just maybe the normal width that it is, imagine if you have a tumor in your colon that your bowel movements have to squeeze by, where you might start getting pencil thin stools. And so it's important when you use the restroom, hey, we all got to be grown, be big boys and girls. Turn around and look at anything that comes out of your body because that can be an early warning sign for something like colon cancer. So yes, change in stool caliber. Yeah, good.
Limitless Sky
Hey, welcome back, Limitless Sky.
says stomach pain.
Stomach pain. You can get abdominal pain, abdominal cramping. That could be definitely a warning symptom.
All right. Over on IG.
Hey, welcome IG. What I do for y'all IG? Oh, listen. Who is this on IG?
Miji.
Miji? All right. Check it out. I went to my book club went to meet the author of a book. It's I Can't Get Enough by the New York Times bestselling author, Kennedy Ryan. We had so much fun. The author was there. And so I did a little post of that. Every now and then, y'all, I'm talking about things other than medicine and other than kids and other than basketball. Bump them kids. So I posted that on there. And yeah, I'll be posting something else. I'm gonna give y'all something today. Yeah, I'll give y'all a little something over there on IG. But what do you have to say about this here? What's a colon cancer symptom?
Chronic constipation.
That's good. You can definitely get constipation, and the tumor can even block the output. You know something else that can happen? You can, even after bowel movements, you might not feel empty. You might feel like something is there. And yeah, that could be constipation, or it could be the backup of the stool being blocked by the tumor, or just the tumor itself giving a sensation of fullness or constipation. Good.
Opposite of that, Miss Aileen says diarrhea.
Diarrhea. Okay. Yes. So you can get constipation, you can get diarrhea. Yeah.
Jetty says bloody stool.
Absolutely. You can get bloody stools. And Ms. Jetty, it's not always just bright red blood in the stools. You can get dark, tarry, black stools. And that's a sign typically of digested blood. Or you can get maroon stools. So bloody stools for sure. Good.
Stephanie.
Hi, Stephanie.
Stephanie says melena, weight loss, anorexia.
That's right. Melena. Melena is the dark black tarry stools that I talked about. Certainly you can get weight loss, unintentional weight loss for sure, and anorexia. All of those. Very good. All right.
TS.
Hey, TS, welcome. Welcome
Along
back.
those, TS says there can be 0 symptoms also.
Come to the front of the class. Come on up here, TS. There can be 0 symptoms. There can be 0 symptoms, which is why getting your screening, getting detection is so important. And so by at least the age of 45, if you have average risk, and start talking to your doctors by the age of 40, no later, if you are a Black person or if you have a family history. And here's something for family history. If you know of a first degree relative, father, mother, brother, sister, who got diagnosed with colon cancer, at least 10 years prior to the age of that person being diagnosed, ask your doctor about screening. For example, if you had a dad who was diagnosed with colon cancer at age 50, by no later than the age of 40, you should be having the conversation about your screening, and possibly even before. Okay. And certainly if you have one of these syndromes like familial adenomatous polyposis, it could be in your 20s or even teens that you're getting screened. If you have ulcerative colitis, same thing, earlier than that. And because, yes, you don't always have the bloody stools, the weight loss, the abdominal pain, you can have 0 symptoms. Very good. Very good. All right, where are we in this myth versus fact? We got to keep moving, don't we?
Statement 2.
All right, let's go with statement number 2. That's good, y'all.
Eating a high fiber diet can lower your risk of developing colon cancer.
All right, what say ye?
All right, I'm gonna share a couple from IG on this one since I missed
Okay.
them on the first question. TP Trip says a fact.
TP Trip says a fact that fruits and vegetables can decrease your risk for colon cancer. Okay.
Lex says myth.
Hi, Lex. You don't think what you're eating has anything to do with it, not fruits and vegetables. You don't think fruits and vegetables can decrease. Okay.
Dwayne says fact.
All right. Hi, Dwayne.
Denise says fact as well.
Hello, Denise. This is all on IG?
Yeah, I missed them on the first two. I pulled them in here. And Miji says a fact as well.
You think it's a fact? All right. Well, it's a fact. It's a fact. So, and it's really interesting because for many of us who are, medical doctors who've been trained traditionally, for a lot of us, we talk about diseases, treatment, diseases, medications, diseases, procedures. And oftentimes the emphasis is not put enough on how food and nutrition really can be helpful. Food is medicine. And we now know that eating diets that are rich in fruits, vegetables, fiber really can decrease your risk for colon cancer and other cancers as well. When you're eating foods that are high in antioxidants, that are anti-inflammatory, and certainly when you reduce the amount of red meat you're eating, things of that nature, we now have scientific data to support that these fruits, vegetables, fiber, these things really can decrease your risk for colon cancer. And so, yeah, food is medicine. What you're putting in your mouth really does matter. Yeah. All right. Myth versus fact statement number 3. Well, I love when y'all participate. Number 3, we got IG over there popping. Mm-hmm.
Since the 1990s, the rate of colon cancer in adults over 65 has actually decreased, while the rate for adults under 50 has more than doubled.
And I think this is a little bit tricky. Let me see what y'all say if we get a mixed bag in responses. What we got, Shador?
All right. We have Lisa.
Hi, Lisa.
Says a fact.
A fact. Okay. So you think that for people who are over 65, that their rates have decreased while the young folks have really had an increase. All right, Lisa. We'll see.
Lisa, TS agrees as a fact.
Okay.
Gospel fan.
Hey, welcome back, Gospel fan.
There's a fact as well.
Okay.
Ada, hello,
Hi, Ada.
says a myth.
All right. Okay. We're going to mix it up a little bit. Just step on
Trucker,
out there.
Trucker Layla says it is a fact.
All right. Welcome.
Yeah, I'm trying to find. Oh, Swansley says a myth.
A myth. Okay. Okay. Well, it's a fact. It's a fact. And here's why. So we know that traditionally we've said that, age was a big risk factor for colon cancer, mainly people over the age of 50, which is why back when I was in training, it really wasn't recommended for you to even get a colonoscopy if you had average risk until you were 50 years old. But as I mentioned, the sharpest increase in people getting colorectal cancer has been young people, 20 to 39, by some studies, 20 to 49. And so here's why that makes a difference in the number of young people getting colon cancer versus older people. If you're someone who's over 60, over 65, then it has been recommended for you to get your colon cancer screening, right? Well, oftentimes colonoscopies will pick up precancerous lesions like polyps. And so if you are getting your colonoscopies and you're 60, 61, 65, 67, then something that possibly would have been colon cancer is now being caught early. You might have a benign polyp removed before it turns into cancer. And typically polyps are slow to develop cancer. It might take 10 years before a polyp turns into cancer. And so in this case, you can catch the polyp before it turns into cancer. And what happens? You're decreasing the rate of colon cancer in the older people who are already getting colonoscopies. But now, we already said that if you have average risk, then it's recommended that you get your colorectal cancer screening by the age of 45, but that misses certain people, right? Chadwick Boseman was diagnosed at 39, passed away at 43. He still would not have been recommended, for average risk to have had a colonoscopy. What happens to the 25-year-old, the 27-year-old? They're not being screened for colon cancer. And so now their rates are increasing while the older people who are being screened are catching lesions before they even become colon cancer. And so that's why it's a fact. The numbers of colon cancer are decreasing in the older patients, who are being screened, but not in the younger patients who, at least as of now, at these young rates, they still don't meet the threshold for getting colonoscopy. So we'll have to figure out kind of better ways for our screening in young people. Yeah, that was good. Thank y'all for participating. Please make sure you give us a like in here because we're about to be giving you more evidence-based information. And y'all keep on participating and coming to the front of the class. Where's Miss Jetty? She need to be in the front of the class too. All right. So now let's move Shador into our weekly dose where we give you a fresh take on the hot health topics in the headlines you simply can't get anywhere else. Well, we talk about dementia quite a bit here on the Dr. Frita channel. We talked about Wendy Williams very recently, and Bruce Williams has been back in the headlines because his wife has shared the progression of his frontotemporal dementia. And so let's go ahead and play that clip, and then we'll talk about dementia versus Alzheimer's versus frontotemporal dementia. Are they all the same things? What's the difference?
Bruce Willis's wife, Emma, is opening up about the moment she noticed a change in her husband.
For someone who was very talkative and very engaged, he was just a little more quiet. And when the family would get together, he would kind of just melt.
Welcome to the party, pal.
The legendary actor who made a name for himself in the Die Hard films also started to stutter, something he had as a child.
A little removed, very cold. Not like Bruce, who is very warm and affectionate.
A brain scan revealed the disturbing truth. Bruce was suffering from frontotemporal dementia. The doctor said there was nothing that could be done. There was no cure. Bruce secretly struggled for years. In 2021, on the set of the movie American Siege, he had to use a device called an earwig so someone could feed him his lines.
Bruce is in really great health overall. It's just his brain that is failing him.
But the language is...
Yeah, the language is going.
Were there days that it would be Bruce again?
Yeah, we still get those days. Not days, but we get moments. Sometimes you'll see that twinkle in his eye or that smirk. And, I just get transported.
Here we go. 1, 2.
One of those joyous moments came earlier this year when Bruce danced around the kitchen with ex-wife, Demi Moore. And you could see the twinkle in his eye during this birthday celebration in 2023.
And it's just hard to see them. Because as quickly as those moments appear, then it goes.
Yeah. Yeah. For those of us who've been Bruce Willis fans back from Moonlighting to Die Hard, my favorite Bruce Willis film by far is The Sixth Sense. If you haven't seen it, I certainly recommend that you see it. So let's talk about dementia, frontotemporal dementia. We'll talk about Alzheimer's as well. But I want you to put in the chat and write the word memory first so we know how to find your comment. Write memory. And I want you to answer the question. Before hearing Bruce Willis's story, where he was diagnosed with this frontotemporal dementia at a pretty young age, relatively young, write what memory loss meant to you before knowing this story about young people getting dementia. And also, if you care to share, if you're dealing with a family member with dementia, I want you to share some of the warning signs that you got when you first knew that the person had dementia, and what even are some tips that you might be able to share on how to help to be a good caregiver for someone with dementia, and maybe how to take care of yourself if you're the primary caretaker for someone with dementia. But put memory and then answer those questions for me, please. Before this Bruce Willis story, what did memory loss mean to you? And share, if you have a loved one, if you know of someone with dementia, what were some of those warning signs, and what are some tips you have on how to cope, how to properly care, or some things to help care for your person with dementia. All right, so what is dementia? So dementia really is a collection of symptoms related to cognitive impairment, okay? And so with dementia, you can have issues with memory. You can have issues with executive functioning, meaning carrying out tasks like writing a checkbook or remembering the multi-step directions of a recipe, remembering the different steps that it takes to bake a cake, remembering how to do something as simple, or what used to be as simple as washing clothes, okay? Remembering the order of opening the washing machine, of putting the clothes in there, of being able to scoop or put the pot in for, the washing machine, knowing how to find the cycle, multi-step activities that requires executive functioning. And with dementia, you can lose that. And so basically cognitive impairment. With dementia, I want you to think of it like an umbrella. It's the big kind of overriding, over-encompassing term that deals with cognitive issues and oftentimes memory loss. But under the big umbrella of the term dementia, you have different types of dementia. One being Alzheimer's disease, which is actually the most common type of dementia. And Alzheimer's disease we're not just talking about symptoms, we're talking about a brain disorder, okay? Where literally you have abnormal proteins in the brain, like amyloid you can have, or tau protein. And it's actually a disorder of the brain. And yes, it does lead to memory loss, executive functioning, all of these things. So it is a type of dementia, Alzheimer's disease. Another type of dementia is the frontotemporal dementia. Now, while with Alzheimer's, most patients are older when they're diagnosed, older than 65, the difference in memory issues occur early on in Alzheimer's. With frontotemporal dementia, patients tend to be younger when they present, anywhere from 40 to 65 years of age, okay? And we definitely know that Bruce Willis was less than 65 when he presented with those symptoms. And his wife shares that stuttering was one of his symptoms, okay? So I'm curious to see what you all say under memory when you talk about loved ones that you know of and how they presented. So with frontotemporal dementia, very specifically, the frontal lobe is affected and the temporal lobe. And so with the frontal lobe, you might have issues with impulse control, okay? If you've normally been a pretty polite person about society, you might walk up to somebody and just be like, oh, those shoes are ugly. Oh, I don't like your face. I don't like you. You just might say rude things. And it wasn't your typical personality before. You might become hypersexual. You might have just different impulse issues. And then your language will be typically affected with frontotemporal dementia, where you might have issues with understanding language and issues expressing language. And they talked about with Bruce Willis how, at least earlier on in the diagnosis, they had to have someone kind of feeding him his words, something he did not need before. He could just memorize all of these, paragraphs and paragraphs on the script, but he was having problems with language. And there are other issues. And, is pretty a current and sensitive topic with Wendy Williams, where she received that diagnosis of frontotemporal dementia. And it's still controversial. And of course, those of us on the outside looking in don't have privy to her records. But in her case, we don't know if it's frontotemporal dementia, like they say that it is it alcohol-induced dementia? But either way, these are other subtypes of dementia. Parkinson's as well, Lewy body dementia. And so dementia is the big umbrella term. And then you have different types of dementia, subcategories. All right. Did anyone put anything about loved ones and warning signs and kind of some coping cues?
Yeah, a little bit of also Angela.
Hi, Angela.
Angela says old age.
So yeah, definitely as, just getting older, but it's interesting. Dementia is actually not something where it's just like, oh yeah, with old age, everybody gets dementia. It literally is a brain disorder or symptoms that are considered to be abnormal. But yes, older age will put you at the highest risk for it. But everyone who has old age certainly doesn't have dementia. And I'm sure that you all can think about 90-year-olds in your life, 95-year-olds. My Uncle Charlie, we just lost my Uncle Charlie in his 90s, had great mind, great memory. So just because you have old age does not mean that you get dementia, but certainly an older age is a risk factor for dementia.
Right. Miss Aileen says,
Hi, Miss Aileen. Forgetful
or not able to do daily tasks.
Right. And so that could show up in a subtle way, right? So, a lot of us will, forget our phones. Where's my phone? Where are my keys? Things like that. But if you're dealing with someone who becomes very forgetful, asking you the same question over and over again, forgetting what day it is, not being able to do the task like we talked about, not being able to make a peanut butter and jelly sandwich, kind of keep those things in order on what to do. And so it can start off with simple tasks, even though they might, for the most part, still be able to function, still be able to take care of themselves, still be able to live alone. That's an early warning, okay? Becoming forgetful and some simple tasks might be forgotten early on. Good.
All right. Limitless Sky says
genetics. So certainly there can be genetic predisposition if you have, again, first degree relatives, if you have siblings, brothers and sisters who have dementia, who have Alzheimer's, that could put you at risk if you have parents. But of course, we know sometimes it can occur spontaneously. A family member might have dementia and no one else in the family for as many generations as you can think of, so we don't always have it, but certainly it can be genetic and family history can put you at a high risk.
All right. Life be lifing.
Oh, hi, life me lifing.
Life be lifing says, my mom has Alzheimer's. First warning sign was her forgetting things within a minute of telling her, such as a password. To care for myself, it has been important to grieve each step and loss.
Oh gosh. So I'm sorry. Sorry that your mom has that diagnosis, but I certainly thank you for sharing. And now I see why your name is what your name is, because baby, life be lifing. But that's true. You might tell someone, and sometimes someone will tell you something and you forget, but there's a difference, a distinct difference that you pick up in someone if they're forgetting things that they normally would have retained. And you're right, it is a grieving process, because even though your loved one is still there who has dementia, they're changing. And so there is a grief in the loss of the person, at least in the way that they used to be. And so it's just very important to understand and to enjoy those moments, just like what Bruce Willis's wife was sharing, just moments that just really show, oh, that's Bruce, he's there, and those moments might be fleeting, which we saw her get emotional. And it's okay to grieve those moments, even though your loved one is still alive. I pray that your mom does well and that you do well and that you make sure you take care of yourself mentally and physically while you're helping to take care of your mom. Thank you for sharing. Yeah,
absolutely. Miss Marina shared. She says a friend has early signs. She would say something rude, then the night she said it. This happens every time I see her.
So personality change. So having personality change can be a component of people with dementia, in frontotemporal dementia, as well as Alzheimer's and other forms of dementia. And so you really can have someone who's normally, pretty sweet person, polite, follows all of the societal norms, and they might just start kind of hurling insults more frequently and possibly forget that they do. So yeah, personality change is really something that can happen with dementia.
All right. And I'll share a couple from IG, Dr. Frita. Miji says memory or horrible language and HTI problems.
I'm sorry, you said HTI?
Yes, HTI is what she says.
Yeah, tell me what HTI is.
All right. And also shared that her full-time caregiver for, that her neighbor takes care of his mom, and she also forgets how to use the restroom on her own.
That's true. Yeah. So sometimes your loved one, if they can't go to the restroom on their own, or not remembering the steps, if there's someone who used to always make sure that the toilet was clean, or they didn't sit on it, or they use paper towels, they might just start plopping on it, or kind of be sitting there and just kind of trying to figure out where the toilet tissue is. Yeah. So something that you might not think about, or things that we take for granted, running the restroom, using the restroom, no big deal. As the dementia progresses, and sometimes it could be early in the phase or late in the phase, different symptoms will pop up at different phases for different people. No two dementia patients are alike. But yeah, that's one of those things with caregiving. You might be sitting there and the person always used the restroom on their own before, and then you start realizing, oh shoot, they need help. So yeah.
Mm-hmm. All right. Okay. And Kofi from IG shared, full-time caregiver for 7 years, nearly took me out. The last few months were the worst seizures and inability to swallow.
Inability to swallow. So, and bless you for being a caretaker for 7 years. And that's a word, what you just said, almost took you out. And I'm glad that it didn't take you out. But a lot of caregivers feel like supermen and superwomen, like they can handle everything. But as caregivers, you have to take care of yourself mentally. I've had patients come to our office where, the patient is taken care of. Well, the patient with Alzheimer's, their hair is done. They got the little lip gloss on, nails done, fresh, nicely dressed. They don't miss an appointment. And I look at the caretakers, oftentimes the daughters, for example, and their hair looks a mess. They haven't taken care of themselves. They haven't been to the doctor since the beginning of time. And their mental health is really, being something that's starting to suffer. And if you're a caretaker and you don't take care of yourself, that's no good, because it can become frustrating. You can even take it out on the person you're caring for, get frustrated and agitated, because oftentimes patients with dementia will, with the personality changes or the rudeness, like what was mentioned before, they will take it out on the person who's there, which is a caretaker. And so if you don't have your mental situation in check, you might start getting mad at the person you're taking care of, even though logically you recognize that the rudeness or the personality changes, that it's not the person with dementia's fault. So for caretakers, you must take care of yourself. And I know that's easier said than done, but if you have any type of ability to get a home health person to come in, even just to give you some relief for a few hours, or if there is an adult daycare service where, don't think of it as abandoning your loved one or trying to get rid of them. No, you have to take care of yourself in order to be able to take care of others. And so dropping your family member off just for a few hours so you get fresh air, so you can get your nails done, so you can read a novel, so that you can make sure that you are taking care of yourself. Or as you just said, being a caretaker can almost take you out. And what good are you to the person with dementia if you a mess? So good. Thank you for sharing. Okay.
All right, Dr. Frita.
All right. Y'all, thank you for participating. All y'all need to come on up to the front of the class. Yeah, that's a tough one. But so we see that Bruce Willis is progressing with his frontotemporal dementia. But remember that dementia is the constellation of symptoms, and it's the big umbrella term, and the other types of dementia are parts of it. Alzheimer's is the most common, typically in older people, and the frontotemporal dementia it less so starts off with memory and more in behavior changes, language changes in the beginning. Very good. All right. So now moving on to our next part of our weekly dose. Let's talk about Billy Porter. We know Billy Porter is an actor, a director. I believe he's a producer. We know he's a fashion person, and he's always quite open about his life. He somewhat recently shared that he has a diagnosis of HIV. He talked about the shame of that before, but now he's out, he's sharing. And I also learned that he's been diagnosed with diabetes mellitus type 2, which is a reminder that the stereotypes don't always work, because we think about living with obesity as being a big risk factor. Billy Porter is very thin. For as long as I've seen him in the public eye, he's very thin. And so I mentioned those things because they are two conditions which can compromise his immune system, right? They can cause him to be immunocompromised. Well, now we know that he has been living with the diagnosis of sepsis. And so let's play this clip and let's talk about some of the warning signs and symptoms of sepsis.
The opposite of welcoming for the Broadway revival of Cabaret. The show has announced it will be closing in 2 weeks, citing the unexpected illness of the current MC, Billy Porter. The producers of the show say he is recovering from a serious case of sepsis, meaning audiences will have to settle for an understudy. The show had already been slated to close in about 6 weeks.
All right. So let's just quickly talk about sepsis. And then I talk about some warning signs and symptoms. And then in the chat, I want you to write sepsis. And I want you to answer who's most at risk for getting sepsis. And have you ever ignored, not necessarily about sepsis, but have you ever ignored what seemed like minor symptoms in yourself, and then they later proved to be more serious than you thought? So write out sepsis, who's most at risk for getting sepsis, and then have you yourself or a loved one ever ignored what you thought were minor symptoms, and then it ended up being something more serious, but put sepsis first there. So with Billy Porter, so yes, he had sepsis. Sepsis is really just an overwhelming reaction to an infection that your body has, really an incorrect reaction, because instead of your body just fighting the bacteria, the virus, the fungus, it starts to malfunction. It might cause your blood pressure to drop. It might cause multi-organ failure, fatigue, change in mental status, and certainly it can lead to you not being alive. Sadly, over my decades-long career, I've had many patients who've passed away from sepsis, which turned into septic shock. And so any point of infection can lead to sepsis. Urinary tract infections, especially in the elderly people and the immunocompromised, it can start off in the bladder or in the kidneys, and then it can turn into an overwhelming infection and lead to septic shock. Pneumonia can start off in the lungs, okay, and then lead to septic shock. So that, kidney infections, diverticulitis, okay, having an infection in some outpocketings of your intestines can do it. Even skin infections, okay, a cut, things of that nature, especially if you're immunocompromised. And so one of the acronym that can be used to look out for sepsis, TIME, TIME. If you have a temperature change, be it a high fever or hypothermia, okay, even a low temperature, that could be a warning sign of sepsis. Infection. And so if you have an infection, as we were just mentioning, on any part of your body or on your skin, that could be something that could predispose you to an overwhelming infection or sepsis and even septic shock. Mental changes. Oftentimes when you have septic shock, you can have mental changes. And so you might see a loved one who's had fever, been a little sick, but if they start showing you signs of confusion or altered mental status, they could be septic. Okay. And so it's very important to kind of watch out for these things. Did anyone say anything, Shador, about sepsis?
Yes. So Miss Aileen says symptoms are sweaty skin, shortness of breath.
Very good. So if you have diaphoresis, the sweatiness, the shortness of breath, that could be a sign of sepsis. Very good. We also know diaphoresis can be a sign of things like hypoglycemia or low blood sugar or even heart attacks. So definitely chills, sweats, that could be, a sign of sepsis.
True Blue.
Hi, True Blue.
I guess people who are at risk of sepsis are chronic lung disease patients.
Right. So specifically, if they get pneumonia, right? So you got chronic lung disease, where you can have asthma, you can have bronchitis, things of that nature. But then certainly if you get infection or pneumonia, then that can put you at risk for having sepsis or septic shock. Okay. Anyone else?
Yes, ma'am. Kofi on IG says, I burned myself once and got infected, need to take 1,000 milligrams of penicillin for 14 days.
So burning is not just simply the burn mark on the skin, right? Especially if you get more severe burns, like 3rd-degree burns. Your skin is one of your body's best protections against infection. And so if that skin is compromised with the burn, that will increase your risk for having infection, and it can lead to sepsis. I remember when I was doing my residency, my kidney fellowship at Emory, we also took care of patients in Grady Hospital, and we had the burn unit, and many of those patients were septic from burns. Okay, so good.
Stephanie says metabolic acidosis.
You can get metabolic acidosis. And so for those of you, especially those in the medical field, when you look at your labs, okay, so if you go and you look at your My Chart, then you'll see the BMP or the CMP, basic metabolic panel or comprehensive metabolic panel. And then that is a carbon dioxide or CO2. If that number is low, like in the teens, then that means that you are likely acidotic. And so instead of your body being alkaline, like, people talk about alkaline diets and alkaline water, metabolic acidosis could be one of those signs of things that can happen when you have sepsis or septic shock. Yeah, you can get lactic acidosis, and yeah, that's a sign of being very ill. Good.
All right. And Angela says people who've had a recent operation.
People who have had a recent operation, certainly. And we see that all the time, especially if, well, for one, if they're lying down and not really getting up, breathing, moving their lungs in and out, they can be at increased risk for atelectasis or kind of collapsed portions of the lungs, and increased risk for pneumonia. Certainly if an infection is introduced after the procedure, which, we use sterile techniques when we do surgeries, but there's always the risk. And then just being in the hospital, you can get hospital acquired infections, right? If after the surgery you're there. So that's good. That's good. Okay. And some other things, just being immunocompromised, like the HIV, diabetes, chemotherapy. Being a pregnant person is considered to be in an immunocompromised state. So very elderly people. Yeah. So these are some folks who are at risk for sepsis. So yeah. So just remember T for temperature, either high or low. I, if you have an infection to start that could lead to sepsis. M, mental changes. And then E, just being extremely ill. So just pay attention to your body and
I'll share this last one, Dr. Frita, from R. Barnes. He says, my uncle ignored swelling in his legs for weeks. He never went to the doctor. He was rushed to the emergency room and he passed away. Learned it was congestive heart failure, but they said it was sepsis that turned to septic shock.
Wow. And so I'm really sorry that happened. And you're just reminding me on how swelling feet and ankles can be a whole lot of things. So yes, congestive heart failure can cause it. And once y'all finish watching this live, check out my most recent video that I released on the YouTube channel, where I talk about causes of foot and ankle swelling. Congestive heart failure is one of them. Also blood clots, also liver disease, also chronic venous insufficiency. But also for patients who have chronic swelling, sometimes that skin can be compromised, right? Have you ever seen anyone who's got swelling to the point where the skin is stretched and it even starts to crack? Well, of course, now there you have it. That skin, that barrier to infection is being compromised, and they can get infections that way, which can lead to sepsis. And so that's a possibility. I'm sorry that happened to your uncle. And it is a reminder to us to really pay attention to our symptoms, to seek help. And now you can't make grown folk do anything, but just do your best for loved ones, even if they're resistant to go into the hospital. If they're sick like that, certainly if you think they could be at risk for sepsis, just do your best to get them to seek medical help, because there really is, there's a lot of treatments for the sepsis. Of course, antibiotics, and then other support that they might need, IV fluids, breathing machine, dialysis, whatever to support if they have multi-organ failure. Real good. All right, so let's try to run through these last ones pretty quickly. Y'all make sure you give us a like, give us a share, give us a subscribe if you haven't already. Y'all have really been on today with participating, and so I love it. I love it when my med heads participate like this. And if you want to join the membership, we definitely have a good time, and you get a little extra. I appreciate you here, of course, and these likes are a free way to support the channel. If you join the membership, then you'll be able to join us for our monthly live Q&As, where it's members only. I sit here, and instead of me talking about all these hot health topics, I talk about you. You bring your questions, you can type out the questions, or we put up a link and you can come and we can talk about it. And so that's once a month. But then every week I release members only videos. And again, I put a couple out. I put one out this weekend, one out on September 11th, where I give you kind of some behind the scenes and a little bit of extra medical knowledge and just some fun conversation for my members only. So we're having a great time. Click the link in the description to join the membership, or go to my one-stop shop, drfrita.com. All right, let's talk about Selena Gomez, you know, the actor, the singer. She has lupus, which she shared. Once you finish watching this live, check out my video on Lupus Explained right here on the Dr. Frita YouTube channel. And again, we're up to over 897,000 subscribers here on the Dr. Frita YouTube channel. If you have not subscribed, please do, because we're going to be at 900,000 soon with your help, and then to 1 million. Y'all, come on. We give evidence-based information. So please subscribe. Please give us a like. But yeah, I have a good lupus video here to explain. But Selena Gomez has shared that she has lupus. She got diagnosed as a teenager. And we know that lupus is an autoimmune disease. So instead of your antibodies just fighting bacteria, viruses, germs, things of that nature, your immune system turns on you. The same way an autobiography is a book written about oneself, an autoimmune disease is a disease where your antibodies attack yourself. They attack oneself, and it can cause all kinds of things, including kidney failure, skin problems, arthritis. Well, Selena Gomez shares that she does have arthritis, and she's using her life experience with the arthritis to actually help in this product, this beauty product. She's also had kidney failure before. She's open about it, and she's had a kidney transplant. So yeah, so check out Selena Gomez. But let's go ahead and play the clip first, where she talks about having lupus, and then also about this beauty brand, how she's kind of turned her living with an invisible disease into a way to help others.
With lupus from 16 or 17. It was a very brutal process, and I didn't enjoy it at all. But cut to a few years later, I was able to visit a child in the hospital. They would not look at me until I said I had lupus too. And that's when I knew. That happened to me because of I could do that moment. So then when I was going through a heartbreak, I immediately, wrote my best music and wanted to be there for every woman or a man or whoever, going through that journey. And then there was the kidney transplant I walked through, and all these things that may seem like they could bring someone down. I try my hardest to say, at least they're not alone. If I keep going, hopefully that means someone else can keep going. Because I don't want to always do it, but I want to for them. When I got
All right. She's always been so transparent. And for those of you who are kind of old school and knew of Selena Gomez when she was dating Justin Bieber, Shador, do you have that photo of Justin Bieber with Selena Gomez? She like a baby back then, but you remember back in the day, they had a very public relationship. But at any rate, so lupus is one of those diseases that's an invisible disease in a lot of ways, because you look at her, she looks like she's totally normal. Ain't nothing wrong with her if you glance at her. But meanwhile, all these years, and yes, and during these times when she was with Justin Bieber, she'd be on stage, she'd be moving, she'd be dancing, she looked young, she looked like, the picture of health. But meanwhile, she had arthritis, she had kidney failure, she had other issues as well. And so lupus is one of those invisible diseases. In that, we refer to it as that in a lot of ways, because when something is not obvious, when an illness is not obvious, it's difficult for people to have compassion. Okay. If you work and you just say, hey, I don't feel well, my illness is bothering me, they might look at you and be like, you look better than everybody in here, but you might be sitting there having pericarditis. We know that Toni Braxton is living with lupus. She's had heart disease and all kinds of things, and she's been up doing concerts, and it's difficult to look at someone like Toni Braxton, look at someone like Selena Gomez, and know that they're sick. And so what I want you to do is I want you to put invisible in the chat and give me some examples of some other diseases that might be invisible, that might not be obvious, that you might know of loved ones who have. And I'll give you one right now: people who are hearing impaired. Okay, especially if the hearing is not totally gone, they might, they might be up at a party getting themselves something to eat, and you might say, hey, while you're up there, will you pass me, a piece of broccoli? And they might come back with nothing. You might not say anything. You might be like, how rude. And you might not know that even though they can hear or they can read your lips, they might have the invisible disorder of not being able to hear. So give me some examples of what you think some invisible diseases are. Meanwhile, I want to play this next clip, Shador, on what Selena Gomez is doing to use her living with arthritis, the lupus-induced arthritis, and how it has caused her to come up with this very successful beauty brand.
The fragrance is actually very unique and special. Well, one of my favorite things about all of our products is we try to make them accessible for people who have dexterity problems. I have arthritis, so sometimes I don't have the strongest hands to maybe unscrew something, or I don't know. Sometimes it's just a little hard. That's me. But I wanted it to be easy. So all you have to do, there's no cap. You just turn it till you hear that click. And just, you could use your whole hand and just spray it away. And I hope that it just helps people keep it good to go. There's no missing parts. You're just ready to go with a quick bottle and a quick spray.
I love that. I love that because, you know, she's not the only person with lupus. She's not the only person with arthritis. And so making her products accessible, I think that's great. And so, and we can keep this conversation going in the replay crew. But yeah, definitely, we'll take a couple if anyone did share any. What are some other invisible diseases that might make it difficult to maneuver because people don't automatically look at you as someone who might have an accessibility issue? Did anyone put anything in there yet?
Yes, they did share.
Okay. We'll do a couple.
All right. Shay.
Hi, Shay.
Epilepsy.
Epilepsy, absolutely. Because if you're not actively having the seizure, then no one knows. And you might be out at a party with strobe lights, you know, or you might be somewhere where your friends are doing things and you're getting dehydrated, or other triggers might be happening, but people around you just don't know. Or you can have the type of epilepsy where you have an absent seizure, where you're sitting there and it's not an obvious tremor or convulsion, but it might be something like lip smacking or eye blinking. They think you're just kind of zoning out, but it could be one of those invisible diseases. That's actually a good one. Yeah.
Angela says degenerative joint disease.
Yes. So you might be looking all dressed up, fine as wine, and really not being able to move as much as you want to. You know, you might be hanging out with family members and they're, you know, doing tours all day or going upstairs, and you might look, and not because you're lazy, but your knees might not let you get up those stairs, or you might have debilitating back pain, but you look fine. You might look just great, look fine as wine, but really you might be in chronic pain with degenerative joint disease. So yeah, that's another one of those invisible diseases. So yeah, I want y'all to keep this conversation going in all of the chats, because what I really would love for it to do is open people to sensitivity. All disabilities aren't obvious. All diseases are not visible. And so if someone tells you they're not feeling well or tells you that they're going through something, don't look at them and be like, ain't nothing wrong with you. You look fine. Be sensitive, because there are certain invisible diseases, and it's really hard to maneuver because people are proud and they don't want you necessarily in all of their business. But if they tell you something, and I hope you're listening to me, human resources and people who are bosses at jobs, all diseases are not obvious. They're invisible diseases. Let's keep that conversation going in the comments and in the chat. All right. And so I do want to give y'all a little public service announcement. Kissing bug. There's something called the kissing bug, which really might be endemic. And that might sound real cute. You know, who doesn't want to be kissed? Okay. Start off with a kiss and ended up like this. You don't want to be kissed by a kissing bug, because this cute little bug carries a parasite that can be really life-threatening. Yeah, it can be fatal. And the reason we call it kissing bug is because they tend to bite you around your face. They tried it. Yeah. Around your mouth, around your eyes. And if you get bitten by this kissing bug and you get the parasite, it can lead to something called Chagas disease. And some symptoms will include, or can include, like swelling around the eyes. And here's what happens. Okay. Warning alert. If you have a queasy stomach, this is the lunchtime hour. If you have a queasy stomach, this might bug you. But the way you get the infection is if you're bitten by the kissing bug, okay, and it's carrying the parasite, and then say you scratch or you hit, and so now you break your skin perhaps by the scratch. If that bird's excrement, feces, not the bird, if the bug's excrement, feces, if that kissing bug's poop gets into your skin, well, now you can get that parasite. And so if that kissing bug is kissing you around your eye and you kind of scratch it and you get some of that feces in a cut or broken skin in your eye, then you can get some swelling of the eye. So that's one of the signs that you've been kissed by the kissing bug. You can also get high fever, body aches, myalgia, nausea, vomiting, and it can lead to some chronic illnesses, heart disease. Okay. It can lead to dilated heart. It can lead to aneurysms or outpouching in your heart blood vessels. Okay. So the Chagas disease can have chronic implications, as well as digestive or GI, gastrointestinal problems. So we know that the kissing bug is in at least 32 states. Okay. And there's been documented disease in at least 8 states, including Texas. So it's here. Okay. Y'all, it's not any gloom and doom. I'm just trying to keep y'all informed as we always do. So the kissing bugs, you saw the picture of it. They're here. And then that is one kiss that you want to miss. So make sure, check it out, look up your local departments of public health and find out if Chagas disease is in a state near you or if the kissing bugs are there. Okay. All right. Well, this has certainly been a wonderful conversation. Make sure that you go ahead and give us a like on your way out the door. Make sure you give us a follow, subscribe, follow us on all social media platforms. I mentioned, that was on News Nation this morning. I do lots of medical media, national news shows, local news shows. And the best way to know is to follow me, because when I find out that I'm doing something, then I'll put it on my IG, my TikTok, my LinkedIn. I'll put it on Facebook. And so if you follow me and have notifications, you always know when I'm going to pop up and do these different shows. But when they provide me with links, I put them right here on the YouTube channel. I have a playlist, television appearances. And so you can go and you can see once I get those links. And you can go ahead after we finish this live and check out some of the different shows I've done, including the Don Lemon Show, Truth Talks Live, of course, other News Nations, 11 Alive NBC, The Griot, whole lot of things, our local CBS. So yeah, just check that out. Also, just make sure that you go to drfrita.com. That's my one-stop shop where you can check out my favorite blood pressure cuffs, my favorite juicer. I have a discount code for you for the juicer that I love to use. You can get my book, Under Pressure, A Guide to Controlling High Blood Pressure, with all of my specialties. You do know I'm a board-certified kidney and high blood pressure doctor. So make sure you click the link. You can purchase that book as well. And if you are a member, thank you to all my members who joined. Remember, we are going to do our monthly Q&As, but make sure after you finish this live, you check out the members-only videos that I put up. And then for anyone listening, if you want to have a conversation with just me one-on-one, nobody else, just the two of us, I do have a telehealth concierge service where I can give you medical information from anywhere in the world. I talk to you, I get a full history. I can give you a first opinion, second opinion. So for all of that learning that I love to do, all the board certifications I've gotten, I can share that information with you personally, and we can talk about your health. And so we've been having really good responses. In fact, when I get off the line here, I've got some more concierge telehealth visits. So please take advantage of that. I'd love to talk to you from wherever you are in the world. All right. Well, thank you, Shador, as always, for being a wonderful co-host. Thank you to all of my med heads for all of your participation today. And I will see you next Monday, noon Eastern Standard Time, same bat time, same bat place right here. And I appreciate you for making Monday your healthiest day of the week.